Hi, my name's Leah, and I'm here today to talk to you about injury management. We're going to go through three of the biggest questions that we hear as physical therapists. The first one being, when should I seek treatment? When should I get some help? Second one is, who should I get help from? There's a lot of options out there. It can sometimes be overwhelming, so figuring out who to talk to. And then the third question is, what happens next? For athletes, this is typically the when do I get to play again question. So let's get started. First question is when to seek treatment. Probably the most obvious is with trauma. This is going to be when you hear the dreaded pop in your knee and your knee swells up and you can't put any weight on it, or you get tackled and your shoulder gets twisted into a position, makes it hard for you to lift your arm up overhead. And some of the more contact injuries are typically what we think of as the traumatic injuries. Second time that you definitely want to go seek treatment is when your symptoms just last longer than you expect. So we'll talk in a little more detail in a few slides, but the ideal healing time is going to be within 7 to 10 days. You'll have that acute pain, the acute discomfort for the first 3 days, sometimes lasting up to 5 days. And then you should start to feel better after day 5 and leading through day 10. If your symptoms remain just as bad as they were on day 1 or 2, when you hit day 7 or 8, you should definitely get in and talk to somebody. Also, if some of the symptoms go away, but there's one thing that's just nagging and it doesn't seem to get better no matter what you do, go and talk to somebody. Third instance to go seek treatment is if your symptoms do go away, but then they keep coming back. So oftentimes this is with a muscle strain where you pull a hamstring and it feels better, and then 3 weeks later you pull the same hamstring, or you roll your ankle and it's not that bad, and the next practice you roll it again. So when you have the same injury over and over again, even if the pain isn't that bad, there's usually an underlying reason or cause that you want to get to the source of, and you should go talk to somebody at that point. The last incidence is going to be when your performance is affected. And this is a little more of a gray area. It's oftentimes when we talk to athletes after concussions and try to figure out when it's safe for them to get back to playing, or if they're overtraining and hitting a point of fatigue. So if you notice that you're just not able to move the way you want to because you're tired or feeling uncoordinated, that's a sign that you want to go and talk to somebody. Or if whatever your injury was is just changed the way that you move and it feels like you can't quite get the job done, you can't quite sprint the way that you used to be able to sprint. When your performance is affected, you want to go talk to somebody and get some help, get some ideas on what you can do to get back to your old self. So that brings us to the question of who to ask. So who do you talk to? The coach is typically the first line of defense. They're oftentimes there when the injury happens, whether it's at practice or during a game. And some coaches are going to be quite well versed with injuries. I know I was a coach for a long time, and so I was able to kind of assess and help treat my athletes on the sidelines and give them some advice as a physical therapist, but also as their coach. Not all coaches are going to feel comfortable with that, and so they'll kind of push you over to the treatment tent that might be on the sidelines if you're at a tournament, or to an athletic trainer. If you're traveling, particularly with high school teams, you'll oftentimes have access to an athletic trainer who can assess you, and that's a great resource. If you don't have access to that immediate sideline treatment from an athletic trainer, a PT, a treatment tent, or a coach, then you can definitely go and talk to your PT if you already have an established relationship there, or just find out if a friend or a family member has a good PT that they've used in the past, and your injury isn't really traumatic. You don't need an X-ray or an MRI. You just know that you pulled a muscle and you want some ideas on what you should do to get back on the field. Sprained ankles, muscle strains, joint sprains, persistent pain, that kind of stuff you can definitely go talk to your PT about. If it is a more traumatic event and you're worried that something is broken or torn, and you feel like you need the imaging to give you a peace of mind, then you can go access some of the walk-in clinics. There's a lot of great urgent care clinics in most communities now. I know in my community in Missoula Bone and Joint has a great urgent care walk-in sports clinic that is open, I think, most days of the week. And then there's also the hospital-related urgent care clinics that are around different communities. So Now Care, First Care, places like that, you can go and get some immediate resolution as to whether or not you have an injury that requires, surgery or bracing or casting, like a fracture or a major tear. The last line of defense is the emergency room. So try to avoid it unless you need it, but they are there to help if you can't get in anywhere else. So the last topic is what happens next. When do I get to play again? And we talked a little bit about that acute to subacute injury phase. During the acute injury phase, which is within the first 24 hours, and it can last up to 5 days, you're really trying to control your symptoms. You're trying to calm down the inflammation and the pain. And a little saying to remember for that is the RICE technique, which is rest, ice, compress, and elevate. Heat or ice is a big question, and almost always, we're always in that acute phase, lean towards ice over heat to help calm the symptoms and the inflammation. Once you exit the acute phase and you hit the subacute phase, this is when things should start to feel better. This is when you can start to move again, you can start to put weight through your joint that has been affected or injured, and you can start to work on some exercises that have been provided to you by your physical therapist or your athletic trainer. Your goals during the subacute phase are to get your range of motion and your strength back, and then to get rid of any compensations you may have developed. So making sure you're not limping or moving your arm in a different pattern than you're used to when you're throwing a ball. Just trying to normalize your movement again in a non-threatening environment. And then that last phase is your sport-specific training. So when your range, your strength, and your movement all kind of feel and look pretty good, then you get back on the field and start working on your running, cutting, sprinting, jumping, throwing, get back into the normal sport-specific movements and get back on the field with your teammates. The last phase is the one that's probably the most often forgotten or missed, and that's the final stage of recovery, your postseason plan. This is when your body actually has time to do the work that it needs to do to make sure that you're fully recovered and that this doesn't happen again. So during season, we're just kind of trying to get you through the season, keep you on the field, try to prevent you from having to sit out from too many games. And oftentimes your body doesn't have the opportunity to fully recover because you're constantly challenging it and kind of pushing it back into that competitive environment. So you have to take the time when season is over to look back and say, okay, now it's time to fully get my strength back, make sure that whatever it was that happened during season that caused an injury, you get to the source of that problem, the underlying cause. Was it a lack of strength or stability somewhere? Were you too stiff at a joint or maybe too mobile? Were you developing bad habits with your movement patterns? Did you just go through a growth spurt? Are you overtraining? Is your body fatigued and you're losing coordination? Or did you undertrain? Were you not prepared for season? So these are all the questions that when you go and talk to your PT in your postseason or your athletic trainer in the postseason days, you can get to the source of and answer those questions, put together a treatment plan, and make sure that you spend some of the time that you have postseason finishing your recovery. So thanks for listening today. Hopefully that answers some of your big questions. You can find us online or on most of the social media websites out there. And thanks for tuning in.